Hello, my name is Florence Lewis.
And I'm Kieran Hussein.
And I'm Heather Marsicola.
We are all therapist interns at Purdue University Calumet's Couple and Family Therapy Center located in Hammond, Indiana.
Today we'll be presenting you with information in regards to complicated grief as it pertains to the refugee population.
We hope that this information is helpful not only for mental health providers, but for any of those interested in working with the refugee population.
There are currently over 16.7 million refugees worldwide. The rate of refugees has increased significantly over the past several years due to the intense conflicts in Palestine, Afghanistan, Syria, and Somalia. These countries' refugees make up more than half of the worldwide refugee population. A refugee differs from an immigrant since refugees are forced to leave their country of origin due to persecution, war, or natural disaster. Many refugees experience trauma such as deprivation, homelessness, loss of loved ones, and discrimination. In addition, many refugees witness or experience horrific events such as violent combat, the destruction of homes and possessions, assaults on themselves or family members, torture, and murder.
Resettlement is the process of refugees acculturating and assimilating to their new host country. Resettlement may present social and cultural complexities which have the potential to last a lifetime.
Due to their traumatic experiences prior to the transition and the resettlement process, many refugees are often diagnosed with depression, post-traumatic stress disorder, and/or anxiety disorders. Complicated grief is also prevalent in the refugee population. However, it is often overlooked in mental health diagnoses.
Currently, complicated grief is defined as persistent complex bereavement disorder in the DSM-5. Symptoms of complicated grief include, but are not limited to, persistent yearning or longing for lost loved ones, numbness, detachment, mistrust in others, and difficulty foreseeing the future. These symptoms present for a period of 6 to 12 months. It is important to note that these symptoms do not spontaneously subside. Thus, it is essential to attend to treatment of complicated grief.
Treatments that have been effective in treating post-traumatic stress disorder symptoms have had beneficial effects on complicated grief as well, such as cognitive behavioral therapies, cognitive processing therapy, and narrative therapies. These approaches have empirical evidence highlighting their efficacy in treating complicated grief and the refugee population.
In order to effectively assist refugees to successfully cope with complicated grief, a focus on the family and social support is also necessary. Family therapists are able to highlight and strengthen the resource of social support. This can be done by bringing awareness to how the refugees' distress may be impacting other systems or environments, such as in school, at work, or also within the home. Family therapists can also identify similarities and differences within the family in terms of shared experiences and symptoms among members. Also, the therapist can help the family in working to become more resilient by maintaining old family traditions while creating new ones.
If you are a refugee or are working with a refugee population, please use the resources list provided.